On this Sunday night, the rapid rise of Omicron. The new variant helps set new records.
I'm absolutely terrified by what's expected to happen.
The growing concern over what's in store this winter. Omicron in America.
It is just, raging through the world.
The variant reaches nearly all 50 U.S. states, but Americans are still hesitant to get the vaccine. Pro sports on pause. The leagues hit hard by COVID and the calls to postpone play indefinitely. And the shifting pattern of Tornado Alley, where severe weather will strike next.
Global National with Robin Gill.
Good evening and thank you for joining us. COVID-19 cases and restrictions are on the rise across the country ahead of the holiday season. Quebec recorded more than 3,800 new cases today. That's the most in that province since the pandemic began. For the fourth day in a row, Nova Scotia has set a new single-day record with nearly 500 new confirmed cases. And Ontario is reporting its highest case count since April, with more than 4,100 new infections. The driving force behind the surge? Omicron. And as David Akin reports, experts say more records will be broken and more needs to be done to prepare.
The math of Omicron is simple and inevitable. Omicron's R value, its reproductive rate, is anywhere between 3 and 5 in Canada.
A single case, 2 or 3 days later, turns into 3 cases. 2 or 3 days later, turns into 9 cases. 2 or 3 days later, it turns into 27 cases.
Now, only a small percentage of the Omicron infected will need hospital care, but with the sheer number of expected cases, even a small percentage could overwhelm healthcare systems.
If we even see, 0.01% of all the cases, and we expect, a third of the population to get it, that's enough to cause a lot of difficulties in the healthcare system.
Rising case counts have also brought renewed concern for those living in and working in long-term care facilities.
As a physician who works on the front line of long-term care, I'm absolutely terrified by what's expected to happen with the Omicron variant.
One reason for that concern, booster rates still too low.
We just learned that only 32% of the frontline staff in long-term care have their booster, and only 86% of the residents. So this is a clear problem.
We need to really treat this as an emergency at this point in time.
In Ontario, the number of long-term care homes where a public health official has declared an outbreak has doubled in just the last 2 weeks. And those living in retirement homes may also be increasingly vulnerable, where vaccination rates among staff are even lower than in long-term care.
Unfortunately, retirement housing is, the wild west of congregate care. There's, far less oversight than you have in long-term care.
Experts say authorities also need to start promoting the use of N95 masks, as growing research shows cloth or surgical masks do little to stop Omicron's spread.
Anyone who's entering a long-term care facility should be provided with an N95 mask.
This is unprecedented in terms of our case numbers and really, again, just very uncontrolled epidemic growth.
Doctors and other experts say governments need a pivot in their public health strategy to deal with that rapid growth. David Akin, Global News, Ottawa.
Despite this new wave, the NHL season will go on, but cross-border games are postponed for Christmas. In the NBA, the Raptors are still allowing spectators, but only filling the arena at half capacity. There's an international sporting event about to take place in Canada, the World Junior Hockey Tournament. And as Ross Lord explains, there are calls to put that on pause.
At a game that would normally be sold out, the crowd was at half capacity by government order as the Toronto Raptors hosted the Golden State Warriors Saturday night. Both teams have players in COVID protocols, including Raptors star Pascal Siakam. The league-best Warriors didn't even bring their whole team to Canada, fearing stars could end up stuck in quarantine, as the NBA and other pro sports leagues hang on to their seasons by a thread.
It's a minefield, and it has to be. I'm sure the NBA is thinking about all of these potential areas of controversy, these health concerns, very carefully.
The National Hockey League has already postponed dozens of games. 5 teams now shut down through hockey's Christmas holiday break. The Vancouver Canucks weekend games were scrapped just hours before fans were to show up at the arena. a last-minute cancellation that upended some families' weekend plans.
He was all excited for his first game here, and we're from Toronto, but we hate the Leafs, so we came to Vancouver. This was his Christmas gift, and unfortunately, due to COVID, not much you can do.
As stars like the Maple Leafs captain John Tavares are sidelined, there are calls for the NHL to match the National Football League. The NFL has decided to end mandatory testing for players if they're vaccinated and have no signs of illness.
I think you might take it a step further and question, why are we even testing for guys that have no symptoms?
Some infectious disease specialists say there's still not enough evidence about Omicron's severity to start backing off. There are growing doubts about going ahead with the upcoming World Junior Hockey Championship in Edmonton and Red Deer, Alberta, and whether February's Beijing Olympics will go ahead. The NBA seems determined to see its season through, with its lucrative Christmas Day matchups approaching.
If it's feasible and it doesn't look too awful from a public relations standpoint, I think that's what they're going to try to do.
Navigating the schedule is increasingly complicated. Monday's game between the Raptors and visiting Orlando is now off too. There are too many players and staff on the Magic in COVID protocol for them to play. Ross Lord, Global News.
In the U.S. tonight, nearly all 50 states are reporting COVID-19 cases involving the new variant. Doctors are urging everyone to get vaccinated, but tens of millions of eligible Americans are still not immunized. As Jennifer Johnson reports, the American president is preparing to address the nation with a new plan to fight this new wave.
New cases of COVID-19 in the U.S. are now topping 120,000 a day, a 20% increase over the past 2 weeks. Doctors are predicting a winter of severe illness and possible death for the unvaccinated, with the Delta variant still spreading and cases of Omicron now in nearly all 50 states.
If we're going to deal with Omicron successfully, vaccinated people need to get boosted, and obviously people who are not vaccinated clearly need to get vaccinated now more than ever.
But the push to get people vaccinated has fallen on deaf ears for a third of the country. Booster shots, too. Just under 30% of Americans have gotten them so far, with millions traveling for the Christmas holiday. Anxiety is surging, too.
I'm very concerned about it because the flights are full. Inside the lobby is full.
Protect us, don't inject us!
Vaccine hesitancy and opposition remain high, even with more high-profile deaths. Washington State Senator Doug Erickson was an outspoken critic of vaccine mandates. He's now died after a month-long battle with COVID-19. U.S. President Joe Biden will address a nation on edge Tuesday on how the country will fight this latest threat and federal help for communities overwhelmed with the sick and dying. Many hospitals are already stretched thin, including some in Ohio, where the governor has sent in the National Guard to help.
My biggest fear is just, the healthcare system at large being able to care for all the things that we've been asked to do.
Harvard University has joined a growing list of schools and companies going remote for the next several weeks. CNN has told most of its staff to work from home. Many New York City restaurants and Broadway shows have shut their doors as city officials dramatically expand the number of testing sites.
Omicron really has thrown a curveball here. I think that this is a temporary incident. I think Omicron is going to blow its way through the population probably very quickly. But we do face a hard 4 to 6 weeks ahead of us.
Complicating the situation, the two drugs most effective in treating COVID-19 for those who end up in the hospital are not nearly as effective fighting the Omicron strain.
It's a brand new version, and it is so different that it has the properties to potentially be evasive.
Pharmaceutical companies are working on new treatments, but say that will take several months. For now, healthcare experts say vaccines and boosters are our best weapons. Jennifer Johnson, Global News, Washington.
In the UK, London's Wembley Stadium has been turned into a massive vaccination centre in an effort to give out as many booster shots as possible before the new year. Long lines formed outside the country's largest stadium. Britain has stepped up its vaccination campaign in an attempt to counter the rapid rise in infections. More than 82,000 new cases were confirmed across the UK today. Britain's health secretary isn't ruling out further restrictions before Christmas.
We are assessing the situation. It's very fast moving. We've seen with Omicron there's a lot that we still don't know about Omicron. I mean, that's the truth of the matter. The reality is there's a lot of uncertainty. There are gaps in the data. Around 60% of new COVID-19 cases in England are Omicron.
Israel's prime minister says Omicron has sparked a fifth wave of the pandemic across that country. The surge in cases has prompted Israel to look at adding several countries, including Canada and the U.S., to its no-fly list. If approved, travel to and from those countries would be banned. Citizens would only be allowed to travel to one of the listed countries if they have special permission. There are already 52 countries on Israel's red list. In Hong Kong, ballots are being counted in the first election since Beijing changed laws to ensure only candidates loyal to China can run. More than 4 million people are eligible to vote, but only about a third cast a ballot. That's the lowest voter turnout since 1991. Foreign governments and democracy groups are critical of the election, in which candidates must be screened by the government and labeled as patriots in order to run. No one from Hong Kong's largest opposition party participated in the election. Results are expected to be finalized Monday. Coming up, why Tornado Alley may be carving out a new road. More than a week after the state was hit by 5 powerful tornadoes. At least 77 people have died as a result of the storms, and hundreds more are homeless. Officials say the damage could take decades to repair. As the planet continues to warm, there's growing concern the U.S. and Canada could see more powerful tornadoes in new regions. There's a shift in severe weather patterns, but they're not easy to predict. Heather Yourex-West explains.
It was an incredibly rare sight, a tornado touching down at the University of British Columbia, the first tornado spotted in Metro Vancouver in decades, and in November. Only weeks later, disaster, when a cluster of powerful tornadoes ripped through several southern U.S. states, one tracking a staggering 205 kilometers. The destruction was incalculable. Countless homes and businesses gone, dozens of lives lost, some of the missing remain unaccounted for. Even experts are still trying to understand it.
The longevity, the overnight in December, it's really in a class of its own.
The big question then, is this related to climate change?
That is the harder question.
While climate scientists have good data to predict what a changing climate will mean for larger scale weather events like floods and heat waves, tornadoes are more difficult to predict. But there is mounting evidence that the warming climate will influence future tornadoes too.
The models do tell us, though, that a lot of the conditions, the larger scale conditions that are conducive to tornadoes will be on the increase.
And that means new regions could see an increase in tornado activity. The so-called Tornado Alley across the U.S. states of Texas, Oklahoma, Kansas, Nebraska, and the Dakotas appears to be shifting eastward into the Mississippi Valley. That's where the December 10th tornadoes cut a path of destruction through 6 states. Some research suggests that activity could eventually move north into parts of Canada as time goes on.
Here in Manitoba, the Prairie Climate Center is projecting that by the middle of the century, that southern Manitoba in the summertime will have a climate similar to South Dakota and Nebraska.
Exactly what parts of the country could see more tornadoes in the future, scientists can't yet say for sure. But Canadian building codes have been changing to ensure future builds will withstand heavier winds.
Keeping roofs on homes is key. So enhancing the connections, anchoring those roof connections is a big part of it.
The cleanup across the U.S. will take some time. But as with so many efforts to clean up and rebuild after the fires, floods, and storms of 2021, there is that ever-present thought. There will be more. Heather Yourex-West, Global News, Calgary.
Still ahead, the link to ink, why it may build trust in some professions.
You're watching Global National.
Tattoos are still considered taboo in some circles, but body art may not be the perceived turnoff it once was. A new Canadian study shows getting inked may give psychologists more credibility in the eyes of potential clients. Montana Getty explains.
For the longest time, body art has been deemed unprofessional or linked to negative behavior. However, the stigma around tattoos has been changing in recent years. A study done by a University of Saskatchewan researcher shows psychologists are viewed as more competent and trustworthy when they're inked. Saskatoon tattoo artist and shop owner Haley Gardner says it's about time.
The entire stigma surrounding it is a little bit ridiculous.
Over 500 participants, mainly in Saskatchewan, were showed 3 different photos of the same psychologist, but one had a skull and flower tattoo. The tatted professional was perceived to be more confident, empathetic, and likable.
Having super visible tattoos is a form of vulnerability, which I think people would be able to relate to a lot.
Researcher Alexandra Zeidenberg found multiple studies showing professionals in other fields did not get the same response.
People tended to perceive tattooed medical professionals as being less competent, and they had more negative feelings towards them.
According to Zeidenberg, the shift in feelings towards tattoos may be connected to a younger audience or the profession itself.
You're often spilling your secrets and talking about really personal information that might be a little bit different from the way we talk to other medical professionals.
While Gardner relates the change to personal experience and human connection.
Tattoos often are an indication of, personal struggle or triumph that this person has decided to represent on their body.
According to an Ipsos Reid poll conducted by Global News back in 2011, 2 in 10 Canadians have at least one tattoo on their body, although the number has most likely jumped in the last decade. Montana Getty, Global News, Saskatoon.
Hi there, I'm Donna Friesen. Robin didn't know this, but I'm jumping in here to deliver some news about our global national family. Robin Gill, who is anchoring tonight, of course, is leaving us to pursue a new adventure. This is her last day on air, and we know the connection she's built with you, our viewers, over the years, and we didn't want to let her leave without paying tribute to her.
Global National with Robin Gill.
Good evening, and thank you for joining us.
She's always said she knew she'd be a journalist.
French President Emmanuel Macron.
And from the anchor desk,
the extent of the storm damage here
to the field.
This is a fellow road, and it's not lost on the people who live here.
Robin Gill has excelled at delivering news for more than 27 years.
The water isn't going anywhere.
From the floods in British Columbia. Some of the stories, Robin, just heartbreaking. To the forest fires in Alberta.
Right now, this center is a temporary home for them.
Robin has told countless stories of Canadians enduring and overcoming hardship.
Dr. Jessie Greiner has been treating and studying patients.
Always digging for a deeper understanding.
What do you attribute that to?
Earning the respect of her colleagues and exploring and deciphering complex topics.
The picket lines are back.
Here at home.
But here in the capital, the radiation levels.
And on assignment overseas.
Canadian Todd Hall is hunkering down with his own stockpile of.
Witnessing events in the field.
You have this affinity for Canada.
Helping Canadians understand our world.
And they're ramping up efforts.
And the people in it. From her days on the Big Breakfast, Robin has been devoted to keeping Canadians informed.
News, weather, wedding, we have it all here.
And she's never lost her sense of humor.
I am chasing a plane.
Now, she's moving on to a new adventure.
That is Global National for this Sunday night.
Thanks, Robin. We all wish you the very best.
Oh my goodness. Well, as you just realized, this is my team. Thank you so much. Thank you for some of that embarrassing stuff too. After 21 years with Global News, tonight is my final sign-off, and journalism has been the love of my life, and my colleagues often joke it's been my longest relationship. So it was really difficult to make this decision, but I'm leaving with this immense satisfaction that I accomplished so much in my 27-year career, and I'm grateful to Global for trusting me with so many interesting assignments. The best part was that I could report across Canada. It was always my goal, and I'm proud to be a Canadian journalist. My goal throughout my career was to present the facts so that you could make informed decisions about the world we live in. News is about human connections, stories that affect all of us.